Good afternoon, everyone, and welcome for those of you who are tuning in now online. My name is Carlo Martuscelli. I'm a health policy reporter with Politico. And today we're going to be discussing drug shortages and what the EU can do to prevent them. We couldn't be doing this panel at a better time because just a few hours ago, the European Commission published a communication on drug shortages with lots of new policies to tackle the issue. And we do need a solution urgently. Just last winter, pharmacies across Europe ran out of key medicines, including antibiotics and children's painkillers. The risk is that these shortages repeat once more this winter, unless Brussels takes action. The alternative is that member states don't coordinate, and they scramble to build their own separate stockpiles. The risk there is that they make the problem even worse. But before we start, I'd just like to make a few housekeeping remarks. You can ask questions through the Swap Card platform. If you're in the room, you can scan the QR codes. And we like debate, so please talk about us on X or the social media platform of your choice. The hashtag is PoliticoHealthcare. Our speakers today are Monica Diaz, Head of Supply and Availability of Medicines at the European Medicines Agency. We have Maria Jesus Lamas Diaz, Director of the Spanish Agency for Medicines and Medical Devices. We have Daria Kuruchpoye, Vice President of the European Association of Hospital Pharmacists. And we have Adrian van den Hoven, Director General of Medicines for Europe. Adrian, I wanted to start with you just because we had this communication from the Commission just a few hours ago. I know I'm putting you on the spot here, so I hope you've had time to digest it. But, you know, I know that the generic industry has been ringing the bell on this issue for ages. You have complaints about drugs just being too cheap, and that means that makes reliable supply really difficult. So I wanted to know, from your perspective, from an industrial point of view, does the communication go some way to meeting what you think Europe needs?
Well, actually, to my surprise, it does. So I have to say it looks pretty good. It includes a series of activities that are actually already ongoing, some work that EMA and HERA have done together with our members on antibiotics already a few months ago, and it's ongoing. Of course, the pharma legislation is in there. But there are some new things, so there's some work that both hospital pharmacists and we have been asking for, which is guidelines on procurement, which would benefit, I guess, buyers and sellers for integrating security of supply in a very clear legal way into the system, which would be fantastic.
So, sorry, do you mind just explaining that in like a very simple terms, why that's important? Because it sounds a little technical, but from what I understand, it's one of the key issues.
Yeah, absolutely. So I think, the Commission ordered a study, and it showed what I think everybody knows, which is that most medicines procured, so usually by hospitals, can also be for some retail markets, is based on lowest price. So the winner of the tender is the one with the lowest price, and it's usually a single winner. And the study done by the Commission or ordered by the Commission said, well, we should really introduce security of supply criteria into this. It could be multi-winner tenders, it could be reliability criteria, it could be a number of different things. And now they're proposing to introduce this into a legal guideline, which would then bring a lot of legal security for procurers buying medicines and for the companies bidding. And that would reduce, I would say, a lot of the pressure and reward the companies with the best reliability, or reduce the risk of shortages that way.
So just to make sure I'm understanding properly, to put it really simply, does that mean that if a hospital decides to, instead of buying all of its drugs from one company really cheaply, maybe in China and India, it buys half of its supply a bit higher of a price from a supplier in Europe, for example, they don't have to be worried about being sued by the first supplier?
That part about the location is a challenging one from a legal point of view. But
okay, forget the location.
Yeah, so indeed, I think it's to encourage for certain bulk buying, okay? So it has to be a certain amount buy. You could have multiple awards. So the cheapest one, the second cheapest, the third one basically would be the ones who do this. But also you could introduce other criteria like, have you been a reliable supplier historically? Can you demonstrate that you haven't had a shortage or a stock out in the last, let's say 3 years or something like that? And you can introduce this criteria. And why it is important from a legal point of view is because it can be difficult to implement this into laws without then the one losing the tender challenging that.
In court.
In court.
Right. Okay. Great. I do want to return to this communication because it's really full of content. But before we do that, Daria, I wanted to ask you what the situation is with actual drug shortages. So not policy, but the actual problem of drug shortages this winter. Whether hospital pharmacists who you represent are worried that we might have a repeat of what we saw last year, where we had these really widespread shortages all throughout Europe.
Unfortunately, we are really afraid of it, but as we are also, our European Association of Hospital Pharmacists is deeply involved in collaboration with the European Medicines Agency and HERA project, so they are really working hard to preventing this. But for instance, like for other years, this summer in hospitals we also experienced the shortages of antibiotics, which we didn't experience last year. And this really causes us a really big concern, because it was not just in...
Sorry, just on the antibiotics, this was also an issue in the winter, so is there a reason why antibiotics in particular seem to be such a chronic problem?
This year was the problem because there were a surge in not common cold, in colds caused by the bacteria due to, for instance, in COVID, as we all took the hygienic measures, we protected ourselves with masks, then the pandemic stopped, and then we didn't use anymore the masks, we didn't do the hygiene, and the children got to the kindergarten without any precaution. And so there was a really surge in the colds, and therefore the industry couldn't predict so much, how do you say, need to produce so much antibiotics, because they have to predict in 2 years in advance.
Surge of demand.
Yeah, and now during the summer we had the consequences because of the winter, and now despite doing all the possible efforts, we are a little bit concerned of this. And
when you say concerned, are we already seeing any shortages now, or is this hypothetical still?
Unfortunately, the shortages are still an issue in hospitals, especially.
And what medicines?
Still antibiotics and painkillers, as you already said, not just for children, but for normal people, all people that are working class and older people. So this is our everyday problem, and we also conducted a survey this year that participated more than 1,500 hospital pharmacists around 36 European countries, and 95% of them said that the shortages are a current problem, which is the same as in 2019.
95%.
Yeah, which means that the problem didn't rise, but it also didn't fade.
No.
So this is a really huge problem.
Definitely. I mean, 95%, that's a shocking figure. Monica, I do know that the EMA is working really hard on this issue, and I know that recently there was new legislation that expanded the role of the EMA in drug shortages. It created this Executive Steering Group on Shortages and Safety of Medicinal Products, or the MSSG. How's it functioning, and is it active now working on this issue, or is it something that you call when there's an emergency?
No, absolutely. So we have now actually more than 1 year experience of the work of the MSSG, and the group meets roughly once a month and even more frequently if necessary. So the MSSG, as you correctly mentioned, was established as part of MS extended mandate. So now we formally have a role in the coordination of activities in relation to medicine shortages. And the MSSG has a role not only in doing crisis, so a public health emergency or major event, public health emergency we had too, COVID and Mpox, but also in case of major events. But the MSSG also has a role in preparedness activities, so we have to do our utmost to ensure that we don't move into a crisis situation. And that's why the MSSG has actually been quite busy in the past year. So we all know, we've all experienced the shortages of antibiotics, and you alluded to that in your initial intervention. And these shortages of antibiotics last year were actually quite widespread throughout Europe. So it was not one or two countries affected. It was the other way around. It's one or two countries potentially not affected, if not all of them. So very earlier on, the MSSG felt it was necessary to reach out to the main key suppliers of antibiotics in Europe, and that's
was this recently, or
this was a year ago. So really,
okay. So you've been working
reactive reaction to that situation that we faced in Europe. And we contacted the main key suppliers of the European market to see if there was any additional supplies, if there was a possibility to increase production capacity, but of course the lead times are long, or if there were any additional supplies that could be made available to European patients. And we were able to identify a small number of companies that were able to supply a number of countries, and those in most need within the European Union, or some other companies were able to redistribute their stocks throughout Europe. But there was a reactive approach to that situation. We were faced with these shortages, and we were made aware in November of last year. So the MSSG felt that it was important to have a proactive approach. So in terms of managing shortages, we need to move from a reactive approach to a proactive approach. And we felt that we need to be better prepared for the next autumn-winter, so starting now, 23-24. So together with the colleagues at HERA, we've looked at supply capacity from the main key suppliers for a subset of key antibiotics used for respiratory infections. And in parallel, we looked at demand scenarios, so looking at historical consumption of this set of antibiotics. And what we did subsequently, when we collect the information from companies and we put together these demand forecasts, we matched the two to see if there was any shortfalls, to see whether supply would meet demand. And what was the conclusion of this exercise is that for a small number of oral antibiotics and some intravenous formulations of antibiotics, there was potentially a shortfall. So immediately we reached out to the companies to ensure that they could increase production capacity so that these shortages actually do not materialize, so that we ensure that supply matches demand. So that's, of course, an exercise we did for antibiotics. But beyond this exercise, I think what is important for us to bear in mind is that it's not only looking at supply and demand, but also communicating with all stakeholders in the supply chain. So prevention of shortages is a shared responsibility of all stakeholders in the supply chain. So we very much alerted to the prudent use of medicines, and in particular of antibiotics. But also, we've also advised all stakeholders to not stockpile, so avoid hoarding, because if there is a shortage, this will deteriorate further the situation.
Some countries are advising for stockpiles. I know my colleague Helen, for example, has written about how Sweden has advised patients to buy extra stocks of medicine in case of shortages this winter. You're saying they should not be doing that, or the EMA doesn't advise countries to create these national stockpiles?
We do not advise anyone in the supply chain to stockpile. Yes.
I have to ask, because the past weeks have highlighted this new situation of increased geopolitical tension. What you've been discussing is the various forecasts about epidemiological curves, I guess, with the flu, with COVID. I was wondering, is the EMA looking at geopolitical risks to the supply chain at all?
Absolutely. So that's part of our preparedness activities, and we did the same when it was the start of the war in Ukraine. Immediately, we looked into the potential impact of the war in Ukraine to the supply of medicines to Europe.
Have you looked at Israel as well? Yes.
Indeed,
okay.
we are, absolutely.
And have you identified any risks there?
At this point in time, we don't have any concerns, but we have to see how the situation also evolves in Israel.
Maria, I wanted to ask you about this communication from the Commission today, but just before that, because we have been asking about the situation on the ground in terms of drug shortages. I wanted to know what's the situation in Spain currently, and are you seeing any issues already, or will we maybe have to wait until January to see possible shortages materialize?
No, shortages is a common business for us to cope with in Spain as in the rest of the European states. We are working very closely with the manufacturer authorization holders, monitoring availability and matching availability with expected demand of certain medicines. And for that, we have produced a list of strategic medicines, which is very aligned with the list of critical medicines that the Commission says in their communication. I will come back to the communication after. And this list of strategic medicines, we have defined them as critical medicines that need additional measures to ensure their availability. We can provide regulatory measures like fast tracks or measures like that, but this list is also available for all the authorities like price and reimbursement authorities or the Ministry of Industry, for example.
When was this list created? Sorry.
It's been created 1 year ago.
Okay, so relatively recent.
So, and this list is made up of critical medicines.
Critical, how do you define critical?
Yeah, we defined critical due to the clinical importance of the disease that the medicine is aimed to, and also the availability of alternatives. So a medicine is critical when it's needed to provide normal care, and it has no alternatives. And we have two drivers to produce this list. Criticality and also vulnerability. When there is a story of shortages or only one or two producers of this medicine, it qualifies as vulnerable. So with this list, it contains around 500 medicines. We have studied how we are dependent on third countries. And I think this is a very good starting point for many measures that we can put in place at a national level, but also at the EU level. And what we have seen is that when we talk about finalized medicines, 29 out of 500 are exclusively manufactured in third countries. But when it comes to active substance, the situation is rather worse. The list contains 350 active substances, and 1/3 of them are manufactured exclusively in third countries, mainly China and India. A third.
And just to make this distinction clear, that's the ingredients, the active ingredient that goes in the medicine.
Yeah,
so it's the thing that really counts.
1/3 of the active ingredients of the list of strategic medicines are manufactured in China or in India mainly. 1/3 in EU, and the other 1/3 can have several sources.
So let's talk about industrial strategy for a second, which the Commission's communication touches on and elaborates on. Spain is at the head of the Council presidency at the moment. I wanted to know how in the specific area of drug shortages and medicines manufacturing, you see this issue of reshoring, or diversifying supply, or encouraging production from friends. You know, there's different theories on how to go about to do this, but where would you position yourself on this issue?
Resharing can be helpful. It's clear, we have seen the experience with COVID vaccines, that Europe can be a producer of vaccines for Europe and for the rest of the world. But we have to acknowledge that it was an extraordinary situation. And when it comes to normal situation, it's difficult to see that we can reshore every production of every good that we can need.
Should we reshore some production, though?
So, exactly. And we have to choose very carefully which kind of goods or medicines active substances, we would like to reshore. Spain supports, and this is very much aligned with the communication by the Commission, Spain very much supports the idea of an open autonomy, meaning that we need to diversify supply chains and we need to count on reliable partners. So we have to set trade partnerships with reliable providers.
I'm going to put this question to the whole panel, but to you first, Maria. Is there a risk, however, that are China and India, which are major trade partners to the EU and which we sell, especially branded pharmaceuticals in China, for example, that they retaliate if we start encouraging local production too much and therefore, cutting into their market share in Europe?
For those medicines that are now manufactured in Asia, I don't see that even the efforts at the European level of increasing our production can be a threat for them, because they have the exclusivity of a production of many active substances. So the competitiveness from Europe has a limited effect, I guess, in its trade. I don't see a threat from that side.
Adrian, to ask you about the communication, to go back to it, one of the actions mentioned in the communication is a possible use of EU state aid instruments, so basically directing subsidies into the sector. Then there's the issue of procurement guidelines that we already mentioned. What is most important for the industry if we're going to see more production in Europe? Is it the state aid? Is it procurement? Is it something completely different?
It's actually a combination of the two. So I'll try and it's a little bit technical in the communication, but it's well captured actually in there. So I do think we need to have sustainable markets for generics. So to give you an indication, 50% of the generics we sell in Spain, okay, at manufacturing price, so what the manufacturer gets, not the wholesaler or the pharmacist, okay, it's below €1.60.
For how much is that?
50% of all generics.
So like a pack?
Yes.
Okay.
In Germany, okay, for hospital medicines, it's around €1. Okay, so these are the prices we're talking about, okay, and we have to sustain investment in production. We know that, for example, the products most at risk, which are in your surveys, are antibiotics, generic oncology drugs. These are all dedicated facilities, okay, which means you have to have a single factory for this due to the risk of contamination. So you can't produce multiple types of medicines. You can only produce antibiotics or oncology medicines in that single factory. So you have to sustain that. Also, we need to support the environment. So we need to look at the models that we're applying. This tender reform is a great start. We need to look also at the retail market, the reimbursement market, if you wish, because for these ultra-low prices, this is going to be a challenge going forward. Now, on the industrial side, the Commission is not saying we're going to finance entire factories and entire reshoring in Europe. But what they're cleverly saying is, and this is a necessity, if we want to do some reshoring in Europe, we have to do it with a novel form of environmentally friendly chemistry. So, for example, enzymatic chemistry.
What does that mean?
It has a less, so you use enzymes for the chemistry process to reduce the environmental impact. Continuous manufacturing, different types of novel chemistry to lower the environmental impact. Why are they saying we need to support this aspect to enable the reshoring? Because if you don't do this, you cannot legally manufacture using the old forms of chemistry in Europe. And I'm just talking legally. I'm not talking about the protest, the opposition to a new factory producing medicines or active pharmaceutical ingredients. So the Commission is cleverly pointed out in this saying, look, we will support this aspect here, that you can produce in a greener, in a more automated way, also for security of supply, to be more adaptive to changes in demand, as you point out. So it's I think it's the right approach. It's not that the Commission is going to be building factories left, right, and center. They're going to help with this one small aspect. If you see, this was authorized very exceptionally for an antibiotic producer in Austria, Sandoz, and it was exactly this part that was authorized. And this is what the Commission is saying going forward, let's do this. This gives the opportunity to reshore if we want to do it, and we'll do it in a way that is legal and probably will be acceptable for the local populations in Europe. Otherwise, we just cannot do it.
So the factories of the future are going to be different from the factories of 30 years ago, basically.
I would say the chemistry, they might, I don't know if they're so beautiful, these factories, but the chemistry will be different.
Monica, I wanted to return a second to the legislative changes that have taken place so far. So there was that expansion of the EMA's mandate that we mentioned into drug shortages. We also have the pharmaceutical package, which also gives the EMA and the MSSG more powers in drug shortages. Now, one thing that's struck me is that there does seem to be somewhat of a division of competence when it comes to drug shortages in the Commission, meaning that also HERA has some powers, the EMA has some powers there, the member states do as well. Are we at risk of fragmenting the competencies too much so that when we end up in an emergency situation, there's not that clear chain of command and we don't know who's in charge when it comes to tackling drug shortages?
So, of course, it's very important that there is good coordination from all those involved, but it is important that we have the manpower to really go through a crisis situation. And we certainly need national competent authorities, and we've worked at the level of the European Medicines Regulatory Network for a number of years. So that is all up and running, and the MSSG, the national competent authorities, are part of the MSSG. So we have heads of medicines agencies as representatives of the MSSG. So certainly coordination is already there. With HERA, of course, there needs to be further coordination, and we've just undertook that joint exercise on the antibiotics and preparedness activities for next autumn-winter. Now, you referred to the new pharma legislation, and I think what we see also in the communication from the Commission today is that some of those initiatives described in the new pharma legislation will now be put forward, and we will anticipate their implementation. We were talking about the list of critical medicines, so we are, in fact, EMA is developing a EU list of critical medicines based on a methodology that was developed during the structured dialogue in 2021. So the European Commission put forward 4 work streams. I was actually had the pleasure to be the chair of the work stream that was responsible for developing a list of critical medicines. We didn't do that at the time in 2021, but we agreed with all stakeholders around the table on a methodology that mimics very much what was used in Spain that Maria just referred to. So looking at therapeutic indication of the medicine and availability of alternatives. So now we use that methodology. We further fine-tuned, and by the end of the year, as announced in the EC communication, we will have that list, that first phase of the list published. Now, in terms of the other initiatives that very much relate to addressing critical shortages, and I think the communication tries to explain the difference between critical medicines and critical shortages, and it becomes sometimes rather confusing because we have many lists of critical medicines.
Many lists. There's many lists, yes.
And on top we have critical shortages, so it makes it all sometimes rather confusing. But I think what is important to perhaps to explain is that we, as Maria mentioned, when we talk about critical medicines, we talk about the medicines that are most essential for healthcare systems, and we need to ensure the supply at all times for patients. So we need to look at vulnerabilities in the supply chain. We need to ensure that we monitor the supply to patients in Europe. So that is the second phase. First, we establish the list, and then we monitor very closely this subset of medicines. But even for the other medicines, we know that sometimes there are shortages. And sometimes these shortages, they become critical. There are no alternatives. There might be situations where there will be no alternatives, so these shortages become critical. So a medicine that is not necessarily critical and ends up in that list might result in a critical shortage. And we need to have measures in place to ensure that we deal with that. EU coordinated actions, because in most cases, critical shortages affect a number of countries, and that's what we saw with the antibiotics, but also shortages of thrombolytics and also some the diabetic products.
A question about that, actually. Last year, when there were those really widespread shortages that were being reported all over Europe, I remember the MSSG met a few times, but a shortage was never actually declared, or rather, sorry, an emergency situation wasn't declared.
Correct.
Now, that seemed pretty bad. So just to understand how this is going to work going forward, this winter and the one after, why didn't that qualify as an emergency situation?
So, in fact, we discussed with the discussion at the MSSG, and we look at the criteria for classifying a shortage or critical shortage as a major event. And based on that, the MSSG reflected, and also at the point we were in the actual time of the year, because we were coming out of the winter season already, it was felt that situation was not deemed as a major event. Now, we have, with the new pharma legislation, we don't have to trigger a major event to get the MSSG involved. And that is, I think, the advantage of the new pharma legislation. So EMA has additional responsibilities now, and all the preparedness activities that we already undertaking, they will be now, let's say, our daily basis work. We can deal with critical shortages the same way that we dealt before, escalating to the MSSG and putting in place coordinated actions.
So it becomes more of a routine duty rather than an exceptional thing you have to.
That is correct, yes.
Okay, great. Daria, I wanted to ask you about all of this, because we've been talking kind of at the abstract, theoretical level about legislative architecture and industrial strategy, but more concretely, when, as a hospital pharmacist, in your day-to-day job, what do you feel you need to deal with shortages? I mean, you know, legislation is all well and good, but more materially, what are your pain points when you're trying to treat patients and you realize you've ran out of a drug, for example?
So everybody mentioned the solution of our problems. For instance, this study also found the results that every second hospital pharmacist has experienced more than 10 times a shortage of medicines that has just one manufacturer or a wholesaler, so that we come here.
So you notice this, actually. You notice when you only have one supplier of medicine.
Unfortunately, because we couldn't supply from other manufacturers, so I think that China and India would not be afraid of losing any revenue, because we couldn't supply anything, so we went with alternatives. And also our survey found that these alternatives led to delays of care, cancellation of care, suboptimal treatment, adverse events. And also we investigated not just hospital pharmacists, we investigated physicians, nurses, patients and their carers. And one patient, their carers reported even death due to the shortage. So this is really, really not a good consequence. So in my opinion, one of the great initiatives is what is doing EMA and the Spanish agency, and what I would like to point out the really good examples from Belgium and Portugal. They have websites where hospital and community pharmacists reported by themselves shortages and suggesting possible solutions. So when we will have this many stakeholders involved in communication, it will be better. It won't be losing. So
less disjointed, more data.
Yes, yes. So we need this better enforcing faster communication on shortages, so we can prepare much more in advance. We cannot shortages cannot be completely cancelled, for instance. They will happen, but if we have expeditive communication, despite, for instance, industry have legal obligation to report shortages, but unfortunately it does not happen on time. Hospital pharmacists find out about this when the medicine don't come to the hospital pharmacy.
Oh, that's interesting.
Yeah, and there's this problem, especially for antibiotics, oncology medicines, anesthetics, which are used for surgery operations, for the sedation. So it was a really huge problem.
I wanted to ask you about this, Maria, actually, this issue of reporting shortages and where they're recorded, and what insight you have into the supply chains and also what's going on in other countries. And I know this from experience because last year when I wrote an article about drug shortages, I was checking all the national regulators' websites to see which shortages there were. And I noticed, each country, or many countries at least, had totally divergent reporting standards, reporting criteria when it came to shortages. Clearly, there hadn't been any European standardization yet. So at the moment, what is your reporting process like? And are you speaking with the other national regulators? And could we imagine a Europe-wide shortages platform? And maybe that's one for you too, Monica, after Maria responds.
Yeah, thank you. Reporting is not very good sometimes, or I could say even many times, because reports from the industry, they are responsible for reporting potential shortages, comes late, and information is not accurate. And this means that they don't give us time and space to put in place mitigation measures, for example. I understand that industry can be afraid of sharing sensitive information from a commercial point of view, but they have to trust authorities. It's very important, because only working together, we will be able first to prevent shortages and then to manage them when they have appeared. You are right when you say that reporting systems are very different among different national agencies. You are right. You have to bear in mind also that we don't have the same medicines in our countries. We have the centralized, authorized medicines that are common for the whole European Union, and then we have national medicine. So it's not so.
And the older ones tend to be nationally authorized.
Yeah. That's why the platform, and I am sure that Monica will be very happy to speak about that, the platform where the European Commission, EMA, and national competent authorities are building will be very useful. What we have learned from the last years, the pandemic, is that working together is much more useful and productive. And we have very close collaboration among national authorities and EMA. The MSSG is just proof of how close our collaboration is and at how strategic we consider that the collaboration has to be. And this platform will allow to share all the information gathered among the states about shortages. Monica, please.
Yes, so the SMP, the European Shortage Monitoring Platform, is being developed as we speak, and we have a legal deadline to have the SMP fully operational. That is February 2025. So we're working very hard to get the SMP up and running.
Will journalists be able to access it?
So there will be indeed a public platform, so for the public to access information. So that's also foreseen, and we want to make sure that we provide information that is needed for the public at large, but in particular to healthcare professionals. So not only about the shortages, but potential alternatives that can be used in case of shortage. So the work is ongoing, and February 2025 is our deadline. Now, in the context of the new pharma legislation and because of the additional responsibilities of EMA, we will then further expand the SMP. But that is for after February 2025. So now we will, we are working towards the minimum viable product, and that is what is described in the EMA's extended mandate.
Yeah, please jump in, Adrian.
Yeah, so I think this is actually a good work in progress, because I mean, basically the national reporting is so different that you cannot compare the reports from one country to the other, even if it's coming from the same manufacturer. So this is a good work in progress. I think, though, we are kidding ourselves if we think we're going to have a better understanding if we don't start to use more data. We have 10 billion boxes of prescription medicines dispensed a year. There are 200,000 generic medicine licenses alone. We need to use other data. We have the EMVS, the anti-counterfeiting data, which gives you.
Could you integrate that into the platform? Would there be a way?
We believe yes. Of course, it's a
opinions
discussion.
Differ. Okay.
Opinions differ. We believe that yes, because it's the only data source with release into the market and consumption.
Seems like a good use case for AI, actually, all this.
Absolutely.
data.
You have to use AI, otherwise, also to sift through the 10 billion packs, you need to use AI, of course.
That's quite tedious to use a human to do that. We have 20 seconds left. One last lightning question before we finish. Do we need a Critical Medicines Act, given this communication? Very quickly, Adrian?
Absolutely, yes.
Yes.
No comment.
Not at the moment.
The Spanish presidency, fair enough. Okay, well, right on time. Thank you so much to my guests for joining me today. It was a really interesting discussion on drug shortages. It does sound like we're in good hands for this winter. So I guess we'll wait and see. Our next session is a spotlight discussion. Caring for Carers, Has Europe Let Its Workforce Down? Moderated by Joanna Roberts. But we have a networking break, so that will start at 4:30. So thanks so much, everyone.
This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.